Hello everyone. So I figured I'd make a video today and talk about my experience with the surgery I had last Thursday. If you've been following along, you probably heard that I needed a feeding tube put in. I'll kind of explain why, and then I'll tell you how my experience went with the surgery. Spoiler alert, I am doing okay. I did make it through fine, obviously, and I'll tell you all about it. So the reason for needing a feeding tube is because you probably know me as having the end-stage liver cirrhosis, but I also have something called hypermobile EDS, Ehlers-Danlos syndrome. What that is, it is a defect in the collagen in your skin, your connective tissue. And the connective tissue, there's all different types. You know, there's the stuff that holds your bones together. Like all my joints, they pop in and out. You know, I can do funny things with my fingers and bend them in different ways. Now, that's not the only thing that makes you hypermobile Ehlers-Danlos syndrome. There's criteria you have to go to and be diagnosed to actually get the diagnosis, and I did. It's called the Brighton scale. I can explain that more in another video. Today was going to be mostly about the surgery, but so basically what had happened, before I wound up getting symptoms of the liver cirrhosis, I wound up with two hernias down the groin area, inguinal hernias, and they started out, and I thought that was kind of odd because I didn't lift anything crazy. I remember I didn't do anything out of my normal, as far as that goes. So for the life of me, I couldn't figure that out. And then I started getting sick and wound up getting the liver disease and so on and so forth, which you probably remember throughout my videos. That turned up and that almost took me out in 2022. They gave me 90 days to live actually at one point in August of 2022, and I'm still here. How long? I don't know. But for now, here I am. But so along that period, other things were going on. For one, I'd always been in pain my whole life. It was like somebody would take a warm blanket of pain and drop it on my back, and it would hurt from my neck all the way down my spine, into my fingertips, all the way down into my knees and down into my legs. And it would just be constant ache, like a warm ache, like all the time. Taking a shower, getting out of the shower was like 10 times worse. If I went and took a shower, I'd get out and I couldn't even move. It was almost like I was a rusty hinge. In order to keep moving, I had to push myself to move because it's like I became rusty and couldn't move. And the more that I, tried to rest from it, the worse it actually seemed to get. So this went on for years, and I went in and I went to rheumatologists and doctors and tried to get this diagnosed, and they all told me the same thing. You must be under stress. Well, that was 10 years of stress apparently, because I went for 10 years. Finally, I gave up on it. And I decided that, well, then apparently everybody must be in some kind of pain, because for this to make sense, it must be everybody. And I actually thought that everybody lives in pain all the time, or at least a good 95% of the time. Things like changing weather would affect the pain. If it was drier, it would hurt less. If it would get a rainstorm was coming up in a day or two, it would be terrible. I would break out from different things. It affected me in a lot of different ways. And as far as the eating thing, as I would go, and I noticed this probably thinking back, probably a little bit before I got diagnosed with the liver disease, food started getting stuck and I had to remember drinking extra water to get it to push down. And it was just like, I couldn't eat a full, hamburger or hot dog or whatever. I could only eat half at a time, and then I'd have to wait and come back. And I didn't think much of it. I was pretty much a doctor dodger at that point in time in my life. I didn't think much of going in or being talking to anything. I just thought, I was getting older or something, or I don't know. So anyway, so I moved on to where I wound up with the more serious issues, and those serious issues made me have to pay attention. And obviously I started, paying more attention and and I started caring about, trying to get my life back on track and trying to get myself healthy again. And this eating thing just kept getting worse. And when I swallowed food, it would get stuck. Sometimes it would get stuck in there for 24 hours and just be in my esophagus. And yes, food can be stuck in your esophagus and you can still talk and breathe because it's down the other tube. It's not blocking the airway. So it's just very uncomfortable. I would take one of my pills at night and I swear it was like it was tumbling in my esophagus. It had little spikes on it. Like it would hurt to swallow. Now, and I had also had a bunch of varices with the liver disease too. So I assumed that maybe this had something to do with that at first. And then I finally went in and I brought it up and they did tests on me. They tested me. They did what's called manometry test. Basically, they put a tube down your nose and into your stomach and they make you swallow a bunch of times and it reads the pressure the pressures of your esophagus. And they find out that my esophagus isn't letting go. So it's squeezing, but not retracting. And the way esophagus is supposed to work, it's supposed to like open and close as it pushes the food down. Well, mine was just closing like a steel trap. And there's another test they have you do called a barium timed swallow. You basically drink a barium milkshake, a radioactive milkshake, and you drink that down and you take sips of it and they watch it as it goes down. And then the last part of the test is you swallow a dissolving tablet. The tablet takes a while to dissolve because they want to see if it goes down into your stomach. And for me, this just sat there. So they diagnosed me with achalasia, which achalasia is, they don't know the exact cause of it. They know where it's linked to, but the exact reason why it happens, they've never been able to find out yet. So that has started happening, and they told me about this, and I'm like, this is really weird. I've got these hernias. Now, I know the belly button hernia is common with liver disease, but the two inguinals in both of them, and then, the swallowing issue, and, adding the fact that I've been in pain all my life. And I was hospitalized a lot as a kid, too. I had asthma real bad. So from the age of 10 to 20, every year in the spring, I spent a week in the hospital. In the fall, I spent an entire week in the hospital. It was just the change of the seasons would just mess with me so bad. So I was used to hospitals and things like that. So finally, they decided they couldn't do anything. It's out of their wheelhouse at where I was at. The achalasia isn't something they deal with. It's a specialty motility disease. And they sent me to be seen from one of the doctors where my liver doctor is. And everything got set back. They put the referral in, but they put it into the wrong department, and it got forgotten about for 3 or 4 months. And then finally I got back in. Oh, and I'm sorry. Before I got the referral, I had went there and was hospitalized, and they did an EGD, which they'd done before. That's where they go down with a scope. And they've done this 2 other times previous to this. They inject Botox into the muscle to try to deaden it so it's not grabbing as much. And they also stretch it, which they did then too, which didn't give any help, like nothing at all. And they finally did that time, and then I was waiting for to get in with the doctor there, which took 3 or 4 months. Finally I did, and they requested me to do all those tests I already did before. So manometry test was the same thing, same results, but the barium swallow they had me do differently. They told me to drink the entire cupful, and then when I'm done drinking it, when it's all gone, they'll x-ray, which defeats the point of the test. The test is to watch it to see how fast it goes down. But if I sit there drinking this thing and wait for it to go down, of course it's not going to be there. So they did the pictures, and the doctor was like, I don't think you have any of these things. And he kind of, judging by the information he had, he just kind of was like, oh, he's fine. And this just started getting worse. I mean, it was so bad that finally one night, food got stuck so bad, I threw up. And when I threw up, it hurt so bad. And then everything I would eat afterwards, I'd throw up. Like anything that hit that esophagus or the the sphincter muscle between the esophagus and the stomach, I would just throw it up, or I'd be nauseous. I could barely eat anything. I had no hunger. I had no appetite at all. And I was losing weight again. And finally, I went back into the ER back in May. And I went in there and I'm like, yeah, I drank a protein drink and it stuck, for crying out loud. You know, at this point in time, I was just frustrated. And that stay didn't go very well. A lot of things happened. They redid the test for the manometry, or for not the manometry, for the barium swallow test, and they found out that they did it wrong the first time. So they saw the real results. That tablet never went down. It sat there for 18 minutes and never went into my stomach until they finally gave up on it and shut the machine down. So they saw that, yes, food's not going into my stomach, which I've been trying to say forever. So then at that point, they were going to put a tube in my stomach, but there's a lot of times they don't do these tubes. Well, the one reason is for if you have liver disease, they could hit a varice or something like that, and you could bleed out. So that's one of the main things. But also, other than that, is if you build up fluid, if you get retention, it could pull the tube out of the stomach, and that could breach it, and then you'd have fluids mixing, and that would be very bad too. But my liver has been in pretty decent shape over the past year, where the liver doctor was like, it's fine. But they decided not to do it because they said that I have the largest varices that they've ever seen, whatever that means. And that they're completely wrapped around my entire stomach, and that my organs are moved. They're not quite in the normal place. That's when I found out that the Ehlers-Danlos syndrome, with the connective tissue, the elasticity of it, allowed these organs to move to allow extra varices to grow. And when these extra varices grows, yes, it could be more dangerous, but it took the pressure off my liver. It took the pressure off that portal vein, which is why my liver is still able to function. So ironically, one disease is keeping the other disease from, well, you know, taking me out. And which I think that's an amazing thing. I mean, for me, that's God right there. It has to be, for one disease to stop another disease from, you know, saying goodnight to you. And so they finally put in what's called a DOP-OFF. That was what was in my nose. That is a temporary feeding tube. You can't have it more than 3 months. You get infections. I wound up getting a really bad sinus infection, where it rubbed the bone above my nostril completely raw, and it was hurting my throat every day. So that was very uncomfortable. So what they decided to do was they got the liver team together, the ones that would do the normal transplant, and they are the ones that put the feeding tube in. And they cut an 8-inch incision from about my belly button up to about my sternum, which is the bottom of your rib cage. And they opened up and they went in that way, and they sewed the hose directly into the stomach to, one, avoid varices, and two, to avoid it from being able to be pulled out if, you know, I did get fluid build up. So they had to do a lot more in surgery to put this tube in me than what they normally do. A normal feeding tube in the stomach is done gastrically, where they go in through the nose, they go into the mouth, and they do an EGD, and they pull the stomach up to the side of the wall of the abdomen, and they just poke a hole through, and that's the feeding tube, and that's it. But you can't do that when you can't see the varices. So that's why he cut me open to do it. So there was a lot more pain involved and a lot more recovery time, but they did an amazing job. They didn't hit any of the varices, obviously. You know, with the pain medicine, they were right on top of it. In fact, one of the things with my Ehlers-Danlos syndrome is pain medicines and things like anesthesia don't affect me the same way. Like, it takes a lot more anesthesia to get me to go to sleep than it does most people. In fact, I always say it where as soon as I feel the burn, the hot poker going through my skin, that means I'm about to fall asleep soon. Come to find out, most people don't feel that. That is the actual stuff going into your vein, and it does burn because of what it is. But you're normally asleep at this point in time, and you don't feel that. I do every time, except this time. This time he gave me a different sedative. He saw what I had, and he said he wanted to make it as comfortable as possible. And they gave a different sedative. Don't ask me what that was. I'm not 100% certain. And he fed me oxygen and he talked to me until I fell asleep, and I didn't get any of that pain at all this time. So that really impressed me. The fact that they, if you're ever thinking that a diagnosis is just not worth chasing after, that's proof right there it is. Because of the fact that they took this diagnosis and they did what they were supposed to do with it. Doesn't always happen in the medical profession. Sometimes you get looked at like a dog hears a high-pitched sound when you say that you're feeling a certain way or something like that. But it's how you feel. So it hurts to be gaslit and for, to be blown off like what you're saying and how you feel aren't true, or like you're lying or you're full of it. That doesn't feel good at all. And they did a really nice job of making sure that everything was the way it should be, as far as the medicines and stuff. As far as the pain reliever, when it was over, most of those things don't work on me very well. I understood that. I also have a higher pain threshold. I call it, when they say rate your pain 1 to 10, I always say my normal is a 4. So I'm like always in some sort of pain. My 4 could be your 7 or your 5 or who knows. But it's all based on the individual person. But at any given time, I'm always in some sort of pain. Maybe it's not everywhere. It could be in the left shoulder, could be in the foot. I mean, who knows? I get like stabbing pains through weird places at any given time that just show up. And, it was real confusing for me to have to go, well, does this count or does that count? Or totally ignore how I'm actually feeling and give you a number based on what you want to know about. And that's when I decided at that point in time, my base is a 4. So that's what I'm used to being at, my pain level. That's my normal. That's what, it's not good, it's not bad. That's just my even across the board. And I'm fine with that. And anything above that's worse. And of course, anything better, which doesn't normally happen, but it does, it can. And that's that. But they used the surgical glue, so in about 2 weeks I'll fall off. No stitches, which is nice. They got the tube in. I'm not going to show you the scar because, on YouTube, but this is what the tube looks like. It's just a feeding tube that goes into my stomach, and it's got valves and everything, so I can flush it with water. I can crush my medicine, put my medicine in there, and I drink a formula that's established a higher protein level for liver disease. So I actually get, which is nice about this, yeah, it sucks that I have to be this way. I'll never eat a cheeseburger or a pizza again. Let's face it, I haven't eaten one of those without pain in the past year and a half anyway. So, but, all those nutritions is there. So I'm going to look at this as a win all the way across the board. Is it uncomfortable? Yes. Is it a pain? Yes. Can it leak? Yeah. I mean, goofy things can happen with it. But all in all, it's going to allow me to feel better and to be able to have more energy, which is very important to me. I think that's super important. So, but anyway, I wanted to, this was just about the surgery. If you have any other questions, feel free to ask. You know me, I try to be an open book as much as I can. I hope that, these videos help you, and that just know that, whatever you're dealing with, don't ever devalue yourself and say, oh, my disease isn't worse than theirs, or mine's worse than theirs, or isn't worse than theirs, because everybody's different. And the worst thing that's ever happened to you is the worst thing that's ever happened to you. Just because something different happened to somebody else, you're not them. You can only comment as far as what it's like for you. And that is important. That is very important to remember that and to stick with that. But anyway, thanks for joining me on this video. It was a little bit longer than most of mine. Remember, guys, be a river, keep pushing through. Don't let walls stop you. Cut your own path. Keep going, keep pushing, okay? So I want to thank everybody again for watching. Please give me a like and subscribe if you like what you're seeing. And God bless. Take care, everyone.